stroke symptoms, causes, treatment, guidelines, and my point of view. Medical emergency occur when blood flow to brain is interrupted. Sometimes referred to CVA or brain attack. Interruption deprive brain tissue oxygen, leading to cell death. Categorized into various types, especially ischemic stroke, about 85%, and hemorrhagic stroke. Stroke symptoms. In the form of acronym FAST, face throbbing, arm weakness, speech difficulty, time to call emergency service. Additional symptoms include confusion, vision problem, dizziness, loss of balance, and severe headache. Causes high blood pressure, atherosclerosis, atrial fibrillation, diabetes mellitus. Treatment, ischemic stroke, tissue plasminogen activator. This is administered within 3 hours of symptoms. Hemorrhagic stroke, stopping bleeding, reducing blood pressure in the brain. Transient ischemic attack, this is another type of strokes. Guideline, early intervention, no surgical technique, increased focus on post-stroke rehabilitation. Mild stroke treatment and recovery, blood pressure, cholesterol, blood sugar, focus on this, which is risk factor. Aspirin was blood thinning medication, often prescribed to prevent clot. Ischemic treatment, ischemic stroke treatment, aspirin, anticoagulant, warfarin, to manage blood pressure, cholesterol, blood sugar. Stroke volume and stroke volume formula. It is there when when happened first 3 days after the stroke. Neurological assessment, imaging scan, lab test help determine severity of stroke and potential complication. Stroke radiology and diagnosis, CT scan or MRI scan, angiography may be needed later. A stroke first aid, very important. Post-stroke recovery and rehabilitation, physical therapy, occupational therapy, speech therapy, psychological support is very important. A stage of recovery and rehabilitation, which is facility, spasticity increase, decrease spasticity, spasticity continue to decrease, isolated joint movement, normal movement return. New treatment, thrombectomy devices, neuroprotective drug, robotic assistant rehab. Preventing further stroke, post-stroke, diet, exercise, blood pressure monitoring, medication adherence, facts on stroke treatment and recovery. This treatment, the malabsorption activator, person recover fully from the stroke, may occur, are good signs of after stroke, early mobility, improve speech, memory, and promising sign. Lifestyle adjustment: avoid smoking, excessive alcohol consumption, local lack of physical activity, poor diet, obesity. Remember, brain is time. Every minute count in the treatment. My point of view is use of fasting and honey as a conjunctive to the conventional treatment is very important in the treatment of stroke. Fasting improves cardiovascular health, reduce inflammation, oxidative stress, promoting brain plasticity and recovery through autophagy. Honey, Manuka, neuroprotective effect, anti-inflammatory properties, wound healing and immune support. Manuka honey is very important, oral consumption or typical use. Combined role of fasting and honey stroke prevention of recovery is very important. Lastly, we hope you are okay and you are away from any stroke. But if happen, don't forget honey and the fasting as adjunct or helpful means of treatment. Wassalamu alaikum.